After studying this module, you shall be able to know about the major issues, principles, and programs of mental health. Learn about the programs of mental health launched in India and in other countries. Identify the problems with the programs launched in India for mental health. Evaluate the programs and issues of mental health. Analyze the situations faced in the execution of programs in India and how to resolve the issues of mental health. Let me give you an introduction to the issues, principles, programs, etc. of mental health. Issues. Issues are the problems or challenges faced due to the lack of either proper planning, availability of resources, or because the issues which have arisen out of unavoidable situations or questions or problems. Principles. Principles are the certain set of rules and guidelines which give direction to the work carried out with some purpose. Programs. Programs are the structural plans and layouts for functions or work to be carried out in a proper manner while minimizing the possibilities of error. Let us begin with the issues of mental health. Firstly, we are going to talk about science. High quality research studies need to be done for the future to address in mental health knowledge and establish the mental health field on more solid scientific background. In particular, the focus should be on those which identify strategies for promoting mental health and preventing mental illness, exploring new mental health issues and solution to those issues while reducing the risk factors for mental disorders. Next, we talk about stigma. Stigma over mental health prevents people from acknowledging mental health problems and accepting the existence of mental illness, which leads to future problems by making changes more complicated. Such issues can be addressed only by providing access to mental health care, more public education, and promotion of scientific research that lead to more effective treatments for mental disorders. Broader public knowledge and acceptance of the underlying physical causes behind mental illness will inevitably reduce the stigma. Effectiveness. The general public is unaware of the availability of effective psychological treatments beyond psychoanalysis. Scientific strides in the treatment of mental health problems have been made in counseling, medication therapy, psychotherapy, and rehabilitation. Mental health services must fit within other related community-based services. This means better communication and interaction with social services, medical services, and educational, faith-based and cultural resources. Interactive services models help prevent patients' isolation and facilities based on better communication throughout the system make personal shortages in the mental health field more obvious and encourages students to train in this field. Next issue is that of financial barriers. Cost of mental health care facility is the primary reason because of which people do not seek help. When access to affordable mental health care is provided, studies had shown that more people approach for mental health care treatments, then those treatments tend to be more effective. Public education helps in increasing the values that society places upon mental health and increases the demand for such services, which encourages insurers and local government to invest funds in better mental health care facilities or resources. It will eventually reduce the individual cost of mental health treatment. State of the art treatment. Even though there exists a variety of effective, scientifically based mental health resources in most countries, members of the public and even the medical and social services communities are unaware of what is available. Without proper marketing and public education, effective state of the art treatment is useless since no one knows about it. Lack of public demand for new mental health treatment is useless since there is a lack of awareness. People also believe in the old treatments as they feel that they were more effective. But the new methods, which are doubted by the public, it impedes the development of new treatment strategies. Next, we talk about diversity. The most challenging issue of mental health is adapting treatments to age, race, gender, sexual orientation, and culture. Such factors play an important role in how mental disorders prevent and how treatment can be implemented to be effective. When mental health services are culturally relevant, members of the different communities are more likely to use them. Mental health professionals must reflect not only sensitivity to the individual's personal differences, but also must acknowledge the validity of the patient's race, culture, and social group in their approach to treatment. Moving on to access. All agencies, whether medical, social, or criminal justice, welfare, or educational, must act to facilitate easy access to mental health care. There is a need to provide mental health care facilities to the public in the case where it is difficult for public to approach the mental health care center. So, the mental health care center approaches the public to identify or detect mental health care issues and problems among public or any other region which is in isolation. It is especially important to ensure that the individuals with severe mental illnesses who are deserted or those who are ready to have voluntary access to adequate mental health services, they are there to reduce coercive assignment to mental health facilities. You can see the table which shows the percentile of the health issues. This data is collected in a community health survey from household respondents. Let's talk about the health issue of alcohol abuse. The key informant percentage is 22.2. The household respondent HH percentage is 19.7. Moderate issues have key informant where the percentage is 30.2. Household informant is 15.8. In major issues, the key informant is 34.9 and HH, which is the household respondents, is 12%. The don't know category has the key informant percentage at 9.5. In drug abuse, the key informant percentage is 19, whereas the HH percentage is 15.3. In the moderate issues, the key informant percentage lies at 27% and the HH percentage is 17.5. The key informant percentage is 44.4 and HH is 13.9 and key informant percentage is 9.5. If we talk about mental illness or emotional issues, the key informant percentage is 33.9% and the HH percentage is 17.8. In moderate category, the key informant percentage is 29 whereas the HH percentage is 12.6. In the major issue, the key informant is 22.6% and HH is 7.4. And in the don't know category, the key informant percentage is 9.7%. Talking about lack of affordable medical care, in the minor issue, the key informant percentage is 17.7, HH is 10.1, in moderate it is 12.9, HH is 14.4, in major it is 59.7 and HH is 34.1, whereas in the don't know the key informant is 3.2. In the last is the HIV or AIDS category, in which the minor issue is 27, the HH is 10.8, in moderate it is 22.2, the HH percentage lies at 5.8, in major it is 1.6 and the HH lies at 5.5, whereas in the don't know the key informant is 28.2. Let us come to the next topic, which is the principles of mental health. Principles of mental health are set rules or guidelines which make the task easier to locate the issue of mental health and find solution to the issue while following the guidelines or principles while approaching towards the solution of the problem, which saves time and money or both in locating the solution of the problem and makes the task easier. There are some specific divisions made to make the task easier, which are as follows: Principle of mental health problems classification, Principle of mental health problems prevention, Principle of mental health problems diagnosis, and Principle of mental health problems intervention. Let us begin with Principle of mental health problems classification. All the mental health problems are classified under certain groups on the basis of similarities in the symptoms they possess or overlap by the governing body of psychology known as the APA, which is the American Psychological Association, and classification system is known as the Diagnostic and Statistical Manual of Mental Disorders, which is the DSM-5, which is used currently. It was first introduced in 1952 by APA. Another such manual used excessively in market is ICD-10 Chapter 5, Mental and Behavioral Disorders, since 1949, produced by the WHO. The classification of mental disorder makes the task easier to detect the problem on the basis of list of symptoms mentioned in the classification. Moving on to the principles of mental health problems prevention. In this category of principles, the prevention program of mental health has some set guidelines also, according to which the prevention program is carried out in action. The prevention program is a planned or structured way so that The preventive measures for any kind of mental health problems will benefit to maximum population in that area. The preventive measure include the below mentioned steps in prevention. Number 1, regarding any kind of mental health issue, awareness is spread among the people via using different methods such as advertisements, road shows, etc. Number 2, for prevention from any kind of mental health problems requires medical facility which is provided to public, which helps the public either to take some advanced measure to prevent or treatment for required mental health problems to detect at its early stage. Next is the principle of mental health problems diagnosis. The principle of diagnosis state that the mental health problems is diagnosed as per the set guidelines given in the classification manual. The problems with overlapping symptoms are kept in the same group. That is, the classification of the problem helps in diagnosis, and the classification manual explains the symptoms of the all type of mental health problems which help in detecting or identifying the mental health problems. Next is the principle of mental health problems intervention. This principle states that the intervention for any kind of mental health problem also has some set rules and guidelines, and for all kinds of mental health problems intervention. The intervention for every kind of mental health problem will be determined by the symptoms of the problem and stage at which the problem is detected. For problems at the beginning stage, intervention program is designed in such a way that the problem will be intervened easily, and for moderate and major stages, the intervention program takes longer duration and medication is required as compared to the problems at the milder stages. For mental health issues, the intervention program can either solve it completely or to some extent, which will depend on the type of mental health problem exists. Moving on to the programs of mental health. Programs are well structured, planned layout for mental health care facilities provided to public either by the government or by the NGOs. Few major programs in India and in Australia will be compared to explain the program of mental health care. National Mental Health Program. The Government of India introduced National Mental Health Program in 1982 to take care of the heavy burden of the mental illness in the country and to provide the infrastructure to deal with mental illness problems and issues. The aims of this National Mental Health Program were: firstly, prevention and treatment of mental and neurological disorders and their associated disabilities. Secondly, to use the latest medical and technological facility to improve general health services. And finally, application of mental health principles in the development to improve quality of life. Talking about the objectives, the first objective was to ensure availability and accessibility of minimum mental health care for all in the foreseeable future, particularly to the most vulnerable and underprivileged sections of the population. Objective number 2, to encourage application of mental health knowledge in general health care and in social development. Number 3, to promote community participation in the mental health services development and to stimulate efforts towards self-help in the community. Moving on to the strategies. Number 1, integration of mental health with primary health care through the NMHP. Number 2, provision of tertiary care institutions for treatment of mental disorders. Number 3, eradicating stigmatization of mentally ill patients and protecting their rights through regulatory institutions like the Central Mental Health Authority and State Mental Health Authority. Mental health care. The mental morbidity requires priority in mental health treatment. Number 2, primary health care at village and sub-center level. Number 3, mental health care at primary health center level. Number 4, mental health care at district hospital level. And number 5, mental health hospitals and teaching psychiatric units. District mental health programs. District mental health program is enlarged and more effective form for covering entire country under mental health care services. The key components of these programs are given as below. Number 1, training programs of all workers in the mental health team at the identified nodal institute in the state. Number 2, public education in the mental health to increase awareness and reduce stigma. Number 3, for early detection and treatment, the OPD and indoor services are provided. Number 4, providing valuable data and experience at the level of community to the state and center for future planning, improvement in service and research. Mental health in multicultural Australia. The Mental Health in Multicultural Australia MHIMA project provides a national focus for advice and support to providers and governments on mental health and suicide prevention for people from culturally and linguistically diverse backgrounds. This includes representation and support of culturally and linguistically diverse communities, which we shall be calling CALD communities, interest in mental health sector and raising awareness of mental illness and suicide prevention in CALD communities, highlighting the role that culture can play in the provision of appropriate and accessible mental health care. The MHIMA project works to promote mental health care, primary care, and community awareness of mental health issues in CALD communities. It seeks to engage with and establish and maintain productive relationships with relevant stakeholders such as the CALD community, consumers and caretakers, state and territory mental health specialists, and mainstream services, relevant government agencies, NGOs, and the tertiary sector. Through these engagements, the MHIMA project aims to improve access, responsiveness, and quality of mental health care services and suicide prevention programs for people from CALD backgrounds, and also facilitate access to information about mental health and relevant services. The focus of MHIMA project is directed towards building networks, collaborative partnerships, developing effective strategies, encouraging evaluation, research and innovation, assisting to build CALD community capacity, and providing strategic policy input to Commonwealth and state and territory governments. The 8 work domains of this are: number 1, promotion, prevention, early intervention, stigma reduction, and suicide prevention. Number 2, policy development and implementation. Number 3, consumer and caretakers participation. 4, community engagement and partnerships. 5 is the communication. 6, service access coordination and continuity of care. 7, workforce and leadership development. 8, research, evaluation, knowledge exchange and innovation. Moving on to National Mental Health Service Planning Framework. The National Mental Health Service Planning Framework, NMH-SPF, is one of the key initiatives contained in the 4th Mental Health Policy Plan. With funding provided by the Australian Government, Department of Health and Ageing, the NMH-SPF project is being led by the NSW Ministry of Health in partnership with Queensland Health and other jurisdictions. The NMH-SPF will have the following characteristics. Number 1, nationally consistent. The NMH-SPF will provide an Australian average estimate of the need, demand and resources for the range of agreed mental health services required across the lifespan and across the continuum of care from prevention to tertiary treatment. Number 2, flexible and portable. The NMH-SPF will be flexible to jurisdictional adaptation and will be presented in a user-friendly environment. The function of the program is flexible for the service provider and service receiver, but it doesn't mean on the cost of affecting the health of the patient. Number 3, not all but many. To ensure national viability, the NMH-SPF will not account for the solution to all the problems, but will give best solution to those problems which is possible for them to give. So, they do not account for all mental health problems, but for whomsoever it is possible, they do provide the required care and facility. Number 4, not who but what. The NMH-SPF will capture the types of care required and what facilities should be provided under mental health care facility, the delivery of services, etc. It can be provided by whosoever can among the health department. Decisions about service provision will remain the responsibility of each state or territory and the Australian government. Number 5, evidence and expertise. The NMH-SPF will identify what services should be provided under which category, which services should be included in general or major category of the treatment. Now let us compare the mental health care programs in India and Australia. The functioning of mental health programs launched in India is slow as compared to Australian mental health program. Australian programs are well structured and well planned to implement. Because of the diversity of the country, India, it is really difficult to execute any kind of plan properly. Because of the lack of other infrastructural facilities, mental health care facility provided in some regions of the country is almost negligible. To summarize it, issues of mental health focus on the problems of lack of fund, human resources and attention of government towards the need of mental health care facilities and many such other problems. Principles focus on the guideline of the classification of mental health problems, prevention from mental illness, diagnosis of mental illness, and intervention of mental illness. Programs focus on the plans to provide mental health facility in India. Mental health programs of Australia are also described to check the flows of programs launched in India for mental health care facility. There has also been a comparison made of Australia and India's mental health programs, which explains where we are lacking in launching the mental health programs.